webcams? Okay. I think we last left off with bronchioles, correct? Bronchi and bronchioles. I think that was the last thing we left off on. Yeah, Shay? Yeah. Okay. All right. So let's go ahead and finish that up, and I'll quickly go through the other slides as well. Forget all that stuff. Forget all that. I don't care. I don't care. All right. So when you're looking at the bronchi and the bronchioles, okay, let's talk about a couple pathologies here. So the first one is bronchitis. All right. Whenever you hear the word itis, what does that mean?
Inflammation.
Inflammation, very good. It means inflammation. Good, very good. So we know that with inflammation, okay, what happens is the following. Let me go ahead and do this. Okay, so inflammation occurs, and what happens is that when inflammation occurs, the blood vessels are going to vasodilate. All right, that'll be one of the the things that goes on with inflammation, and so. What that does is that narrows this person's airways, right? I think we talked about this with anaphylaxis, right? So what happens is this person's airways are now a little more swollen, right? So the airways went from this to this because the tissue around those airways was being inflamed, right? So that's going to be one problem right there. The second problem with bronchitis, not just the inflammation, you also produce excessive mucus as well. So if I get this green over here, we know that the inside of your bronchi, bronchioles, and trachea, they're all lined with mucous membrane. And so as a defense mechanism, specifically part of the innate immune system, your body's also going to produce mucus. Okay, and that mucus is there to help trap any kind of pathogens that might be there, right? It's like, look at me, I'm helping, right? It's like, look, I'm catching stuff. Well, guess what else you're also doing? You're also narrowing the passageway even more by creating more mucus. Does that make sense? Okay, so at that point, what we have there is not only do we have bronchoconstriction due to the inflammation, we also have a further narrowing of the airways because of the mucus production. So it's like, I'm helping, like kind of, but not really, right? So that's going to be bronchitis. Does that make sense, y'all? Okay, what typically happens is that there's some kind of irritant, right? It could be a chemical, it could be some kind of substance that an aerosolized substance that is in the air, and it is causing this kind of reaction. It's causing inflammation and excessive mucus production. So it's usually some kind of irritant. I had a student, for example, who worked in a chemical factory. Sounds like I'm making the story up, but I'm not. He worked in a chemical factory, and what happened was he was constantly inhaling these kind of fumes and everything. I was like, didn't give you any PPE, right? Any kind of equipment to protect himself? And I think he said no or whatever. And because of that, he lost his, he has anosmia now. He lost his sense of smell. So even before COVID, I was like, ugh. I said, you should probably sue them. They didn't give you any PPE, right? But anyway, if you're exposed to a lot of these chemicals, like in the previous example, you can suffer from bronchitis, right? Now, there are two types of bronchitis. There's acute and chronic, right? Acute and chronic. When something is acute, okay, what does that mean? The condition is acute.
It's not severe.
Wait, one at a time, please. I'm all ears.
It's not severe, like it can be treated of the time.
Kinda. You're on the right track.
It's before like a shorter amount.
I can't do speaking. Go ahead.
It's before a shorter amount of time.
So an onset, and then okay, who's the guy speaking? Oh, Hugo. So go ahead and say it.
Yeah. I was gonna say it's for a shorter amount of time, and it's not reoccurring.
Yeah, correct. Very good. So with Hugo, and I think was it Catlin or it was Erica, it was one of y'all. I'm trying to keep track of y'all. Good. Acute means kind of sudden onset, right? And that happens in a short period of time, right? It just happens kind of like this, right? So when you look at acute, this is a sudden onset, right? It happens within a short period of time. So there's acute bronchitis and there's chronic bronchitis. So if acute is sudden onset, chronic means that it's a recurrent, it's a recurrent event, right? Usually I think chronic means that this patient is suffering symptoms or they've been affected by it for like more than a year. Okay, So if a patient is suffering something for more than a year, then it can be considered chronic. It's not really acute anymore because it just keeps happening and happening and happening. So there is acute bronchitis and there's chronic bronchitis. Okay. With acute bronchitis, typically that's due to an infection. Okay. So with acute bronchitis, usually it's due to an infection. Maybe somebody has, I don't know, some type of lower respiratory disorder, like maybe, I don't know, they could have strep throat, and for whatever reason, the bacteria made its way down to the bronchi, and now they have bronchitis, right? So it's usually some kind of infection. Could be like pneumonia, for example. That can cause acute bronchitis. Okay, so it's usually due to infection. I'll put usually here. Usually. Okay, not all the time. There's other cases as well. Okay. With chronic bronchitis, it's usually due to some kind of repeated exposure to an irritant, typically. Okay, like I said before, like working in a chemical factory, whatever. I need a drink. Whew. It's 5 o'clock somewhere, right? All right. I'm kidding. It's soda. Okay. All right. Or is it? So, so acute bronchitis, chronic bronchitis, they have kind of overlapping symptoms here, right? It's just that one is sudden onset, one is recurrent, right? Now, when you look at chronic bronchitis, it is under another umbrella term, if that's not confusing enough. It's under an umbrella term called COPD, right? COPD, you may have heard of before, like if you've been exposed to asbestos and you're suffering from COPD, call us now, right? Have y'all seen those commercials back in the day? Right, when you were at home, maybe during summer, or I don't know, you didn't go to school. Right? So COPD, chronic obstructive pulmonary disease, and the name kind of gives it away. Chronic, it's happening all the time. Obstructive, there's something blocking the airways, right? In this case, it's going to be that inflammation and the mucus. And then pulmonary, it's referring to obviously the lungs. So chronic bronchitis is a type of COPD, right? COPD. And then you have emphysema. Okay, emphysema is another form of COPD, right? Emphysema is another form of COPD. Now, just kind of watch me for now, and then I'll give you the description in a second, right? Okay, so is everybody familiar with the term surface area? Okay, a little bit, maybe. All right, for example, I'll give some food analogy since I'm hungry right now. So let's say that you want to make a dish, right? And you want to, for example, again, I don't know the word saute. If you want to extract all the flavors out of an onion, right? For whatever dish, you're making whatever dish, you're trying to get all the flavors out of this onion, right? Do you just throw the whole onion in there? Even after like peeling it, you just throw the whole onion in there. Do you usually do that if you're trying to like take all the flavors out of it, assuming you're not boiling it? No. What do you usually do before you cook that onion? Chop it up, right? Okay. When you chop it up, what you're doing is you're increasing the surface area of that onion, meaning that you're getting more of that onion's surfaces exposed to be cooked. Does that make sense? Okay. Because think about it. If you kept the onion whole, the only part that you're cooking is going to be the outside of the onion. Does that make sense? Okay. However, if you cut the onion up into like little pieces, what happens is that more of it gets exposed. Does that make sense? Okay, so basically, the smaller the pieces, right? The smaller the pieces, the more surface area gets exposed. Cool? The bigger the pieces, the less surface area gets exposed. Everybody cool with that? I might keep that analogy. I just made it up. All right. Okay, good. That's going to be surface area in a nutshell. Okay. So here's what happens when it comes to emphysema, right? Keep the onion analogy in mind, right? So think of these as like little onion pieces. I'll go over this in a second. These little alveoli, which are the ends of your bronchioles, think of them as like little onion pieces. They're nice and chopped up. Okay, they're nice and chopped up. We're going to find out in a second that alveoli are responsible for gas exchange. They're responsible for external respiration, right? If you look closely at these alveoli, we have these capillaries here, and we have this alveolus right over here. And if you zoom in, you can see that there is an exchange of gases. Can you all see that? Okay, your lungs or your alveoli are exchanging gases with your blood. Okay, we have an exchange of gases. Okay, and right now, these alveoli are in chopped up little pieces, which is great. More little pieces means more surface area. Cool beans? All right. Now, with emphysema, what happens is that over time, these alveolar walls right over here, these alveolar walls get destroyed, right? So for example, this wall gets destroyed, this wall gets destroyed, this wall gets destroyed. Does that make sense? These walls get destroyed because of some kind of like irritant, right? For example, cigarette smoke, right? All the different toxins in cigarette smoke break down alveolar walls like this. So as we break down these alveolar walls, we're not making it into smaller pieces. We're making the whole onion all over again. Does that make sense? It's going to be one big structure rather than a bunch of little structures. Is everybody following me on that with the onion example? Okay. So because we've broken down these alveolar walls, now we have the whole onion rather than pieces. So that means if we have less surface area, there's less opportunity for gas exchange. Okay. So if there's less opportunity for gas exchange, what is it going to look like when this person's breathing if they can't exchange the gases properly?
It wouldn't be like shorter.
Oh, O2.
You got it. Very good. I think I heard Freddie, and I heard, who else? Was it Butena? It was one, yeah. So yeah, shortness of breath. You have less, and plus less O2s being delivered, less CO2s being pumped out. Does that make sense? So overall,
Actually, my mom has this.
what's that?
My mom has this.
Yeah, yeah.
She's in oxygen. Yeah.
I don't mean to intrude, but does she smoke a lot, or you know?
No, never.
It's for a different reason.
Yeah.
Yeah. Usually you see emphysema usually associated with smokers, but emphysema can be caused by other things, right?
They are not sure if it is COPD or emphysema. Some doctor they said emphysema, some doctor they said COPD.
Oh, geez.
It's so weird.
Yeah. Well, I mean, with that classification, it's if they say COPD, they're being very vague about it. But they need to differentiate between chronic bronchitis and emphysema. So it's one of these, right? But yes, they basically have shortness of breath, right? So what is emphysema? Let me go ahead and spell it out for you. And I'm sorry if I'm going so fast. Again, my adrenaline's still going. Emphysema is going to be the breakdown of alveolar walls due to chronic damage or chronic exposure to irritants. Surface area. Zoom in for y'all. I know it's kind of small there. Okay. So emphysema and chronic bronchitis are both forms of COPD because this results in a long-term inability to adequately breathe. Okay, as we kind of were kind of dancing around for a little bit. Okay. All right, now the last kind of pathology we'll go, there's also pneumonia, and there's also a couple other things like pleurisy. Don't worry about those. Asthma, if you notice, it's going to have a very similar kind of overlap in symptoms with bronchitis, right? If you look at bronchitis as symptoms, inflammation of the bronchioles, excessive mucus production, you have something very similar right over here as well. Okay, you have something very similar here as well. Rather than inflammation, we have with asthma, there's muscle spasms, meaning that it's not the inflammation that is being caused usually. It's going to be the smooth muscle that is contracting due to usually allergens, right? So because they have overlapping symptoms, right, it's tough to distinguish them. But here's a couple things that I found that'll help you distinguish between bronchitis and asthma. You ready? Okay, so let me do this step by step here. All right, just kind of the differences between bronchitis and asthma. I'm gonna go ahead and erase this just to make things a little clearer. Okay, so with asthma, what happens is when these folks cough, when they cough, usually due to like allergens, well, let me go and start off with that. Usually due to allergens, or even exercise. Bronchitis, as we already kind of pointed out, can be caused by infection or chronic exposure to irritants. I'm going to color them so it's easier to see. Okay. With bronchitis, usually this is going to be the patient has trouble breathing for extended periods of time, right? Could be a lifetime. Patient has trouble breathing only during asthmatic episodes. Okay, so if they're always having trouble breathing for like several days, a week, months, or even years, that's probably more leaning towards bronchitis. Whereas with asthma, it just when they're exposed to like an allergen or when they're exercising, they only have trouble breathing during like kind of that time. Does that make sense? Okay. What the hell is going on up there? Did y'all hear that? Someone's peeling out over there. The third thing with bronchitis, even with medication, a patient can still suffer symptoms. Okay. In asthma with medication, patient usually recovers until the next episode. The next episode. Does that make sense, y'all, between the two? Okay, hopefully I was able to elucidate that. I mean, for some of y'all, I know it's very simple, again, especially those of you with clinical experience, but it took me forever to find that information because websites weren't being very clear about the distinction between asthma and bronchitis because they had just so many overlaps and they weren't being very precise about it. So I had to really dig, as simple as that sounds. Okay. Now, usually one of the overlapping treatments for both is usually going to be albuterol. okay? Steroids even, but albuterol is going to be a common vasodilator. Okay, this is a vasodilator. Okay, that is part of your pharmacology for your exam 2 study guide, albuterol. Okay, also called salbutamol. Okay, and that is going to be the generic name. Okay, so that's generic. And again, there's many trade names out there, but the two common trade names, as a lot of you know, are going to be ProAir as well as Ventolin is another one. Vasodilator, hold on, not vasodilator, dang it. Sorry, bronchodilator, I forgot what we're talking about here. Bronchodilator, my bad. Okay, if you ever had an inhaler before, one of those things, that was usually albuterol. I kind of miss having an inhaler. It's good stuff. Same thing with braces. I miss having braces. Y'all don't miss braces? They're forever immortalized in your school pictures when you're posing like this next to a tree. I remember with braces, if y'all remember getting them off, your teeth felt very slimy. All right, did y'all ever do that? It felt very slimy. And it was the worst if you're like playing basketball or playing some kind of sports and you got hit in the face. So not only did you get hit in the face, your lips got cut up as well. So I can't see your reactions, but I'm assuming that y'all can relate to a lot of those experiences. So, all right, let's go ahead and pause right there. Let's take a break. I'll see y'all again at 11:25. Sound good? All right, see you in a bit. Okay, and we're recording. All right, with the conducting zone, respiratory zone, I don't really care, okay? Now, the part that I skimmed over a little bit earlier were alveoli, okay? Now, alveoli are located at the kind of terminal end of your bronchioles, right? If you recall, we went over the anatomy earlier in the last class. We have your trachea, we have your primary bronchus, secondary bronchus, and each branch that came off of it were the secondary bronchi, and then each branch that came off of those were the tertiary bronchi. And then when we had these kind of peripheral bronchi, we called them bronchioles, okay? Now, what happens is that there is no gas exchange occurring within the bronchi, within the trachea, within the bronchioles, okay? They're far too thick, right? They have cartilage, they have smooth muscle, they have pseudostratified. There's just too much going on there. So there's no gas exchange occurring here at all. This is associated with pulmonary ventilation, right? Air moving into and out of the lungs. Now, the part where we have actual gas exchange occurs here at the alveoli, and they're going to be these kind of grape-like clusters that are, again, located here, right? And notice that these grape-like clusters, they're highly vascularized, right? And you should already know that term because you took a test over the cardiovascular system. They're highly vascularized, meaning that they have a whole lot of blood vessels, right? Specifically capillaries, right? And we know that capillaries are thin enough to facilitate gas exchange, right? Like this, right? So they're so thin that they allow gas exchange. O2 to the blood, and blood gives lungs your CO2. Everybody following so far? They're super, super, super thin, okay? Now going back, this is gonna bring back some either great or painful memories. The tissue type that makes up your alveolar walls, like a lot of you remember, is called simple squamous epithelium. Y'all remember simple squamous? Hopefully. Yeah. I'm pretty sure in what's her last name? I forgot her last name. I only know her by her first name. Professor Gonzalez's class. We went over that. Remember that? These tissues. She's doing well, by the way. I text her every now and then. So it's made up of simple squamous epithelium. So if it's simple, how many layers does it have? Show me with your fingers. One, very good, just one, right? And if they are squamous, what shape are they? Show me with your hands. They're flat, right? They're flat and they kind of look like eggs, correct? They're flat and they look like eggs, simple squamous. Good, that's a little bit of ANP1. Little ANP1 there. All right. All right. So these are your alveoli. Any questions on that so far? Okay. Now, there are two types of alveolar cells. Okay, two types. The first one is the one that we've been talking about. The one that is kind of the most talked about one is called the type 1 alveolar cells. And they're the cells that we were just pointing out. They facilitate gas exchange. Your type 1 alveolar cells. Okay, they facilitate gas exchange, type 1 alveolar cells. Okay, so these type 1 alveolar cells, they make up the alveoli. Okay, they make up the alveoli, they're flat. Okay. Now, the other type of alveolar cell are called type 2 alveolar cells, and we'll refer back to them in about an hour from now. Okay, oh, that sounds painful. Okay, we'll refer back to them about in an hour from now. And the thing that you need to know for them for now is that they secrete something called surfactant. Okay, they secrete something called surfactant. That's all you need to know for now. I'll explain that a little later. That requires a lot more background. If we have enough time, I'll show you all a Batman clip. If y'all are fans of the Batman movies, the Nolan trilogy, hell yeah, we're gonna watch some of that. Anytime I can incorporate movies into my class, I'm going to take the opportunity. I will not show Grey's Anatomy. I refuse. Far too sexy. Far too sexy. Not enough medical. All right. Okay. Again, all you need to know is just the surfactant thing. That's all you got to know. Okay. Type 1, type 2. The most important for now will be the type 1. We'll go over this a little later on. All right. All right, lung anatomy. There's not much I want you to know here. When you look at the lungs, right? When you look at the lungs right over here, do I have more picture here? Okay. Again, we want to establish our right and our left. Okay. So in our patient right over here, this is his right side, and on the left side over, and on this side over here is his left side. Okay. Now on the right lung right over here, there are 3 lobes. 1, 2, 3. Okay. The right lung has 3 lobes. 1, 2, 3. While the left lung has 2 lobes, 1 and 2. One, two, three. 1, 2. Okay. The only other anatomically significant portion that I want you to know, at least in this context here, is going to be this area here called the cardiac notch. Okay, the cardiac notch. So anybody, what do you think the cardiac notch is used for?
The heart.
The heart, okay. So can you be a little more specific with the heart?
The valves.
The apex.
The apex of the heart, very good, tilts which way?
The left.
To the left, very good, to the left, okay. So because the apex of the heart tilts to the left, okay, that is going to be, we need to make room for that, and that's going to be in the form of the cardiac notch right over here. Okay, so in summary, right lung 3 lobes, left lung 2 lobes, and we should pay attention to the cardiac notch. The rest of this stuff, don't worry about. Don't worry about it. I mean, these are cool topics, but we just don't have enough time. We have to cover the other stuff. Okay. I know it's painful, I know. Cystic fibrosis is a hell of a thing, so is pneumonia and SIDS, but all right.
Does that make the left lung like a little smaller than the right lung then, or are they still the same size?
I think the right lung, I think it's a little bit bigger.
Okay.
Yeah, I think one of the lobes, I think the right lung's a little bit bigger. If we did our fetal pig dissection, I think the fetal pig's right lung has like 5 lobes, and then the left lung has like 3 lobes or something. It's some goofy thing. Okay. And then finally, the last thing I want you to know is the functional blood supply to the lungs, and that is going to be called bronchial circulation. Okay, before I kind of put this up here, okay, if you remember when we talked about the heart, there was blood traveling through the heart, correct? But the heart did not use that blood, right? In the chambers. The heart had its own source of blood called coronary circulation. Do y'all remember that? Okay, very good. All right. Now here's the thing. As it gets a little weird, right? So we have something called the bronchial arteries. The bronchial arteries will be the start of bronchial circulation. All right. So bronchial arteries are going to supply not only the bronchi, but also the lungs as well. Cool. However, they are also going to deposit their blood into our old friend, the pulmonary veins. Y'all remember the pulmonary veins? Okay. So we have a new character in the game, but this new character is going to deposit its blood into a familiar kind of structure we covered before. So I'll leave this up here for y'all to write down. You can see the bronchial arteries right over here. All right, any questions on the blood supply? Everybody cool with that? All right. All right, here's what we're gonna do now. I'm gonna go ahead and do a drawing for y'all, okay? And then after this drawing, we'll take a quick 5-minute break. Sound good? Just kind of reset just a little bit, okay? Because we're about to move into presentation number 2. All right, any questions over presentation number 1? Destiny, anything? No? Brianna? You good, Brianna? Okay, cool. Just checking up on y'all. All right, so so now we're going to move on to presentation number 2. Presentation number 2 really goes over the physiology as opposed to the anatomy from part 1. Okay, so I recommend getting a piece of paper out, or at least turning to a new page in your notebook, because we're going to draw just a little bit. All right, here we go. What should I title this? I should title this something. Let's do lung pressures. I guess that would be appropriate. Sorry if I'm a little radio silent. Please feel free to ask questions. Run out of colors here. Yeah, messy, messy. Now I'll keep it there. It's fine. It'll be redundant though. Cavity. All right. Oh. All right. Sorry, I've got food in my mouth when I'm speaking. When you are finished drawing this, go ahead and take a break. I'll see you all again at 11:55. This will be our last long break, okay? It's 11:55. Please feel free to ask questions during break as well. All right, a bit of anatomy right now, right? Let's see what the heck we actually even just drew. All right, so we know that, let's see, let me pick on some people. Will, I haven't talked to you in a while. All right, Will, what is this? What does this represent?
The trachea.
Sir, very good. That's it. Very good. Alicia, what are these? Alicia, what are these right here? These branches off the trachea. The branches? Starts with the B.
Bronchi.
Bronchi, right? So bronchi, good. Bronchi plural, bronchus singular, right? So specifically, these are the primary bronchi. Okay, very good. Obviously, these are the lungs. Everybody cool with that? All right, very good. All right, now, in order to explain these next ones, parietal pleurae and visceral pleurae, we have to go back to chapter 20 of the heart, okay? Actually, even chapter 1, right? So back in ANP1, if you recall, and we've been over this before, but just to reiterate, we went over 3 types of membranes: cutaneous membranes, mucous membranes, and serous membranes, if you remember that from ANP1, okay? Cutaneous membranes were membranes that were associated with the skin, right? That's cutaneous, skin. Mucous membranes, mucous, right? It's going to be membranes that cover cavities that are open to the environment. So the inside of your mouth, the inside of your nose, inside of your throat. Everybody straight on that? Okay, very good. That's mucous membrane. The hardest one for most students, and even for myself, is going to be the serous membranes, right? And I'll erase this in a second. So if you just want to write this down, it's up to you. Serous membranes, right? Serous membranes, okay, they line ventral body cavities and visceral organs and the surfaces of visceral organs. Yeah, I think that's it. Okay, those are serous membranes. Okay, again, this is just a quick recap, right? So when I say the word visceral organs, I mean, everybody knows what ventral body cavity is, right? Everybody knows ventral body cavity. It's like kid stuff at this point, right? With visceral organs, remember, these are going to be your guts, right? Your heart, your lungs, your liver, your stomach. These are your guts, right? Not your brain, like the guts, right? And so when you talk about the serous membranes, they line those cavities that contain those guts, right? Like the thoracic cavity, the pericardial cavity, the pleural cavities, the abdominal cavity, the pelvic cavity. Y'all got that? Like those cavities. And they also line the surfaces of those visceral organs. So the outside of your heart, the outside of your lungs, the outside of your stomach. Is everybody on the same page here? Okay. These membranes should not be exposed to the environment, right? If for some reason the outside of your heart is exposed to the environment, we got a problem. Yeah. Everybody on the same page? Okay, good. I know these are stupid like examples, but I hope they're kind of coming across. All right. So what we have here is we have 2 serous membranes, okay? If you remember, the word visceral means guts, right? The word visceral means guts. And so over here in blue, we have the visceral pleurae, okay, which is a type of serous membrane, the visceral pleurae right over here. So it's directly covering the lungs, while the parietal pleurae right over here is the serous membrane that is lining the pleural cavity. As you can see right here and right here. These are the same thing. Again, I was a bit redundant. That was my bad. But the parietal pleurae lines the pleural cavity. Okay. Everybody on the same page here? The membranes? Okay, good, good. This should be a reminder of like the visceral pericardium and the parietal pericardium. It's the same thing, but with the lungs. Okay. All right. So this is the pleural cavity right over here. right? This is the pleural cavity. This is where the lungs are contained within. Now, within the lungs, we have a cavity here called the pulmonary cavity, okay? I said before that if you hear the word pulmonary or pleural, that refers to the lungs, right? Pulmonary, plural, that refers to the lungs. But because we're at the lungs now we have to kind of split hairs here. We have to be a little more specific, right? Pleural cavity refers to the cavity on the outside. Pulmonary cavity refers to the cavity on the inside of the lungs themselves. Okay, everybody cool? Yeah? All right. Now, in order to talk about lung physiology, we have to talk about the pressures. And this is where, I'm not gonna lie, like as a student and even as an instructor, like when I hear the word pressures, I'm like, oh crap, we're going to physics and chemistry. Ugh, gross, right? But some of this stuff is just unavoidable. We just gotta walk through this puddle, all right? Here we go with socks on, just socks. All right, so if you remember, I'm going to stop the sharing here. What is pressure? Okay, pressure is the force that is exerted over a certain area, right? One more time. If I have my finger over here and I'm pressing up my finger against this part of my palm right over here, I'm exerting a certain force over this area. Does that make sense? A force over an area. That is pressure. We talked about pressure when we talked about blood pressure, correct? The force that blood exerts on your blood vessel walls. Touch, 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 touch. Does that make sense? If I was blood? Okay, good. That is pressure. So your blood is made up of atoms, correct? It's like, no duh, right? Come on, professor. Right? Good. So your blood is made up of atoms. So these atoms, what they're doing is they're pushing up against these surfaces. And when they do that, they're exerting a pressure. Systolic, diastolic pressure, whatever. Okay. The air that you breathe is also made up of atoms as well. All right. Oxygen atoms, CO, carbon, nitrogen. There's gases everywhere. Does that make sense? The air you're breathing right now is made up of atoms. Hopefully not a bunch of viruses that you're breathing into, but it's made up of atoms, right? Now, the thing is, whenever these atoms, just like your blood, whenever these atoms touch a surface like they are right now on your skin and in your nose and in your lungs, whenever they touch a surface, they're bumping up against it. Okay? When they bump up against your skin or your lungs, they're exerting a certain pressure. Everybody cool with that? Okay? That's what we call atmospheric pressure. Okay? Just like blood pressure deals with blood pushing up against the blood vessel walls, atmospheric pressure deals with gases pushing up against all surfaces it comes into contact with. Okay, everybody cool on the pressure part? All right, very good, very good. All right, let me show you a quick drawing. People are gonna be marked absent. All right, so here's how I'm gonna get this kind of pressure thing across, okay? Let me get my thoughts straight really quick. Okay, so everybody's seen space movies where a ship, anybody watch Star Trek? I know everybody's like a Star Wars fan right now. Anybody just watch Star Trek? No, never mind. Jeez. This triangle, for example, represents a ship, the Star Destroyer, whatever, if you're a fan of Star Wars, right? Look at pizza. So basically, in this ship, right, there are people in it, right? There's people in it. So these people, what they need is they need oxygen, correct? These people need oxygen, obviously, right? So what's happening is in this spaceship, we're pumping oxygen into the ship, right? So pretend these little blue dots represent oxygen. Does that make sense, y'all? They represent oxygen. So this oxygen is not only supplying these people on the ship, the spaceship, with oxygen. The oxygen gases are also, and the other gases are also pushing up and applying a pressure on everything it comes into contact with, right? Atmospheric pressure. Does that make sense, y'all? Okay, good. So we have pressure there, right? Now, if I'm going to refer to the vacuum of space, okay, this spaceship is in space, obviously, right? And this vacuum of space, are there any gases in the vacuum of space? Yes or no? No. Do you all see any gases out here? No, there's no gases out here. So when it comes to atmospheric pressure in space, especially the vacuum of space, the atmospheric pressure is 0. Everybody cool with that? The atmospheric pressure is 0. Okay, so one more time. There's pressure in here, right? There's pressure in here. There's no pressure out here. Everybody cool with that? All right, there she is. All right, keep that in mind. Okay. Now, in every space movie that y'all have ever seen, what inevitably happens to a spaceship? What happens to it in every space movie? Interstellar, Star Trek, Star Wars, what eventually happens to it?
They blow up.
What's that?
Blow up.
It either blows up or even before that, what happens? Yeah, there's basically going to be a hole or a rupture in the hull. Does that make sense? Like it gets blown up, and then what happens to everybody on the inside and all the atmosphere on the inside? What happens to it?
Gets sucked out.
It gets sucked out. Okay, so you have these people that are out here, right, and then you have a bunch of gases out here. Does that make sense, y'all? Right, so we've all seen this before. Okay, so keep that in mind. Now, here's why that is, right? So what's happening is if the pressure on the inside, let's assume that they keep sea level atmospheric pressure, okay? If the pressure on the inside is going to be measured at, for example, 760 millimeters of mercury, right? The millimeters of mercury is just a unit of measurement like meters or liters, okay? Just kind of roll with it. Okay, 760 milliliters of mercury, that's going to be your atmospheric pressure there, okay? Compared to the outside over here, the outside is at 0. Everybody cool with that? The outside is at 0. So here's what happens. And this is where it's going to get kind of goofy. Okay, stay with me here. Okay. So relative to each other, one is going to be under positive pressure, one's going to be under negative pressure. Okay. So relative to the outside right over here, this guy is under positive pressure. Does that make sense? This is going to sound like silly, but I'll just put, that sounds stupid. I'll put PP over here. It's under positive pressure. I know what it sounds like. Why did I draw in yellow, right? It's under positive pressure. So in reference to the outside, it's under positive pressure, okay? Now, if we do the reverse, right over here, for example, in reference to the inside, this guy over here is under negative pressure. Does that make sense? Right, so relative to each other, right, one is under positive pressure, one is under negative pressure. Does that make sense? Okay, let me see. April, does that make sense? Cool, okay, good. Yeah, this is the part where it gets kind of goofy, so I'm trying to make sure everybody's on board here. Okay. So positive pressure, negative pressure. So here's what happens. We know that if there's a rupture in the hole right over here, people get sucked out, right? People get sucked out. What's really happening here is we have, and this is going to bring back, I'm going to activate some of your memories. You ready? What's really happening here is that we have the movement of molecules moving from an area of high concentration to an area of lower concentration. All right, what is that phenomenon called? Not you, Erica.
Osmosis.
Diffusion.
Not osmosis, good. Diffusion. Okay, good. Diffusion, y'all. Okay, good. Even if you said osmosis, osmosis is a specific part of diffusion, specific form of diffusion. So if you said diffusion or osmosis, you're on the right track. Okay, so good. Y'all remember that from A&P1, diffusion? Hell yeah, right? Okay, good, diffusion. So the movement of substances from areas of higher to lower concentration, we call that diffusion, right? Simply diffusion. Okay. All right, here's the important part here, or at least one of the important parts. So hopefully all of my storytelling kind of made sense. Hopefully it didn't bore y'all. Hopefully it actually informed y'all. Right? So what I'm saying here is positive pressure, pushes, negative pressure pulls. Or if you want to be a little, if you're okay with that, it sucks. Positive pressure pushes, negative pressure pulls, or sucks. Jeez. All right. So everybody cool on that so far? So watch this. From this perspective, if you are inside this ship, okay, if you are a bystander in the ship, just watching your homeboy or homegirl kind of get, blasted into space, right? From your perspective, they're being pushed out. Does that make sense? They're being pushed out from your perspective, okay, because you're under positive pressure. If you were out here, this perspective would be they're being pulled out. Does that make sense? Yes, no? Positive pressure pushes, negative pressure sucks. Yeah? Questions on that? Okay, so I'll give another tangible example. You know how when you open up a window or you open up a door that leads to the outside, sometimes every now and then you'll hear a random door close in your apartment or your house. Do you ever hear that before? All right, it's like, what the hell? All right, so it's one of two things. Number one, what happens is the atmospheric pressure outside of your apartment or house is under positive pressure. As soon as you open that door, your house, assuming it's under a negative pressure, that positive pressure pushes in, the inside of your apartment sucks that kind of air in, and what that does is that positive pressure will kind of push your doors closed. Does that make sense? So the reason why your doors are slamming in your house or your apartment when you open up the windows or other doors is because you have pressure kind of rushing in. Yes, no? It's either that or it's haunted. Okay, I'm willing to bet it's probably option number one. If it's option number two, then good luck. Cool? All right, positive pressure pushes, negative pressure sucks or pulls, whatever you want. Okay, so it's for this reason why we have this scenario here, right? So in reference to these two, right over here, which pressure is under positive pressure, intrapulmonary or intrapleural? Which one is under positive pressure? Or can we classify as positive pressure?
The intrapulmonary.
Intrapulmonary, okay. And then by default, which one's under negative pressure?
Intrapleural.
Intrapleural. Does everybody see that? Okay. So what's happening is, again, it sounds so crude when I say it, right? What's happening is that the pressure in here, inside the intrapleural cavity right over here, is basically pulling your lungs like this. Does everybody see that? It's pulling them or sucking them, okay? And that's extremely important, okay? The reason why that's important, and I'll type it out in a second, is because your lungs want to naturally collapse. If you were to leave them to their own devices, your lungs will naturally want to collapse, which again, I'll list it in a second. Because of this negative pressure in the pleural cavity, this is one of the forces that prevents your lungs from collapsing. It's literally, hey, you get over here, you stay inflated, like that. That's what the negative pressure is doing.
Like a balloon when it has no air inside. Like,
Yeah. Because the balloon does want to collapse, right? Left to its own devices. You got it. All right, sound good, y'all? Okay, anybody confused on the pressures concept? That's probably the hardest part of the day.
So if from inside of the spaceship. So it wouldn't be that person being sucked out of the spaceship and
Yeah.
being pulled out of the spaceship. I'm just a little confused with the analogy. That's all.
Yeah. So if you're inside the spaceship, Chris, right? From your perspective, if your buddy is being tossed out into space, it looks like they're being pushed out. Does that make sense? It's like some force is pushing them out, right? If you're in outer space watching this whole event unfold from the spaceman's perspective, right? What's happening is this person is being pulled out. They're not being pushed out, they're being pulled out into space. Does that make sense?
Yes.
Okay, cool. Hopefully it does. All right, so it's all a matter of perspectives, right? All right. Now here's what you want to write down here, and I think I'll be done with this this kind of thing in a second. Okay. Well, you know what? No, I have it here. What am I doing extra work for? Hold on, I got it here. All right, here is the important takeaway here. To prevent the lungs from collapsing, you always want to keep the intrapleural pressure more negative than the intrapulmonary pressure. That's huge. This right here. It's probably the most important takeaway of the day. I don't know if I told you all this, but there were rumors going around that spring break might be canceled to make up for our blizzard week. If it gets canceled, are you all going to protest with me? There were rumors going around a couple of weeks ago, or like what, a week ago or so. But because we're getting so close to spring break, I doubt they're going to do that. I'll keep y'all updated, but even if they don't cancel classes, I might not show up. Or sorry, if they do cancel spring break, I might not show up. Y'all need that break. The reason why spring break was created was to assist students with midterms, because you're right in the middle of the semester, and a lot of professors give midterms, and so it gives them a break to either study or recover from midterms. That's the whole reason for spring break, supposedly. So. Some of you already made plans for spring break too, so. All right, questions, comments, concerns on that concept of pressures. Everybody good on that one? Okay. All right, let's go and take another break. I'll see y'all again at 12:25. We're good on time here, 12:25. Now, welcome back. And remember, today's our Friday, okay? So once we're done with this class, you don't have to see me again till Tuesday. Okay, so hang in there. All right, so that is going to be the whole pressure relationship with the lungs and the pleural cavity. Yesenia, I think you asked me a question earlier. Did that answer your question? I can find you. Good?
Yes, it did.
Awesome, very good, very good. Okay, so basically what you want to do is you want to always keep the intrapleural pressure more negative than the intrapulmonary pressure to prevent the lungs from collapsing. I got to close my eyes sometimes to kind of visualize this stuff. Okay, so let's see what happens here when that doesn't occur. This is a better picture here. Let me get my guys ready. Nope, separate. Nope. Whoa. All right. So we know that typical atmospheric pressure, at least at sea level, is 760, right? 760. Now at rest, the inside of your lungs, or the intrapulmonary pressure, is also going to be 760 as well. So let me reduce this font really quick. Dude, come on, work with me. Okay, So atmospheric pressure is 760, inside your lungs is 760 as well. And we're hoping that in your pleural cavity, the pressure there is going to be 756, okay, more or less. All right, so notice here we have this -4. The -4 refers to how it's 4 less than what's here, right? So what's happening here is that this is homeostasis, right? We have the intrapleural pressure more negative than the intrapulmonary pressure. The lungs are not collapsed, okay? The lungs are not collapsed. Now what happens is this poor person over here gets stabbed. I mean, this is literally the infographic here, right? This person gets stabbed. So if this person gets stabbed, right, look what we have here. Now we have the pleural cavity exposed to the environment. So the atmospheric pressure in reference to the pleural cavity is under positive pressure, is it not? It's under positive pressure. If you look at the pressure in the pleural cavity, it's under negative pressure, correct? Does that make sense in reference to each other? Am I losing y'all? Good. Right, 760 is greater than 756. Therefore, 760 is under positive pressure. 756 is under negative pressure, right, in reference to each other. Remember our spaceship example. Okay. So what do we say positive pressure does? Positive pressure does what?
Push.
Push. Okay. And negative pressure does what?
Suck.
Pull or suck. Very good. So what's going to happen here is that as you perforate the skin and the muscle and eventually get to the pleural cavity, what happens? Gases will diffuse into the pleural cavity like this, right over here. And then what happens? Is that 756 going to stay 756? What's going to happen as you introduce more atoms into the pleural cavity? What's going to happen to this pressure?
It's gonna get higher.
It's going to get higher. Very good. It's going to get higher. Does everybody see that? The more atoms you introduce, the higher the pressure goes up, right? So now we have not only 760 over here, we have 760 within the lungs as well. And now we also have 760 in the pleural cavity. Now, is there any difference between the three at this point? No, they're all 760. So you no longer have the pleural cavity more negative than the pulmonary cavity. So again, if you leave the lungs alone to their own devices, what's going to happen? They want to naturally collapse. Does that make sense? Okay, they want to naturally collapse. Okay. Same thing happens here as well. What can happen is that some folks with certain lung diseases, and it can even appear spontaneously, can actually form these kind of weakenings in the lungs walls, right? And these little weakenings here are called blebs. Think of them kind of like aneurysms for blood vessels, blebs for lungs. These little blebs are weakened portions of the lung, and they can just spontaneously burst, right? So guess what? Here we go again. Oh, good Lord, come on. 760 here, 760 out here, and 756. Come on, dude. 756 right over here. As soon as that bleb ruptures, what's going to happen? 760 over here, positive pressure, 756 over here. What's going to happen is gases are going to diffuse into the pleural cavity. So we have the same situation. As you introduce more atoms, more gases into this environment, into this volume right over here, what's going to happen to pressure? Pressure goes up. Does that make sense? Pressure goes up. And so what happens? Again, 760, 760, and 760. Congratulations, collapsed lungs. Okay. So all this is going back to the same concept. To prevent the lungs from collapsing, you always want to keep intrapleural pressure more negative than intrapulmonary pressure. Okay, just keep going back to that same concept, right? So before we move on, I just want to clarify something, right? Again, the lungs want to naturally collapse, right? I've been saying that. The lungs want to naturally collapse for two reasons. I'll give you the two reasons right now. Number one, it's the natural elasticity of the lungs. Think a stretched rubber band, or as even Freddie pointed out, or an inflated balloon. Okay. So the lungs just want to naturally collapse. Okay. The second reason why, which we'll go over in a second, is going to be surface tension created by water. Okay. We haven't gone over that yet, but these are the two reasons why the lungs want to collapse. All right, y'all, how we doing? Good? Okay, I just want to give some clinical examples, okay, really quick. All right, hang in there. All right, so what we're gonna do right now is we're gonna go over this concept called surface tension. Oh, I forgot to pull up the video. Let me find the video real quick, right? So here, while I find the video, check out this video.
Respiration, the lungs expand and contract within the chest cavity. The lungs are encased by two layers of tissue, similar to a fist that has been pushed into a balloon. The space between the layers, called the pleural cavity, is lubricated so that the lungs can slide comfortably across the chest wall. If air enters this space, it is referred to as a pneumothorax. One type of pneumothorax, called a traumatic pneumothorax, can be caused by injury to the chest. A blunt or penetrating chest injury can cause a small tear on the surface of the lung, allowing air to enter the pleural cavity and to become trapped. The pocket of air produces excessive pressure on the lung, causing it to collapse. A spontaneous pneumothorax occurs without injury as a result of certain lung diseases, such as asthma, emphysema, or COPD. Small air-filled sacs called blebs can form on the lungs. If the blebs rupture, they can release air into the pleural cavity. Pressure from the trapped air causes the lung to collapse. However, a spontaneous pneumothorax can also develop in a person with no obvious risk factors or disease. This condition is more common in smokers and in men between the ages of 20 and 40. A tension pneumothorax is a serious complication that can develop with any pneumothorax. If the pocket of trapped air cannot escape, it continues to grow. The increased pressure in the pleural cavity can push the heart and major blood vessels to the other side of the chest. When this shift takes place, it causes a significant drop in blood pressure. This is a life-threatening condition that requires immediate medical attention.
All right. So I want to clear up something that I lectured on this yesterday, and I'm trying to reconcile. Okay, did I mention it yet, or did I mention it yesterday's class? So I just want to make something clear. When somebody's hemorrhaging, right? When somebody's hemorrhaging, what happens is they're losing a whole lot of blood volume. Correct? Everybody cool with that? They're losing a whole lot of blood volume. Therefore, they're losing a whole lot of atoms, to put it crudely, right? They're losing a whole lot of atoms. As they lose more blood, as they lose more atoms, what happens to blood pressure? It goes down. Very good. Y'all are following. Good. It goes down. Now, switch that to air now, okay? So As you introduce, for example, more air, okay, into a space, what happens is pressure goes up. When you infuse saline into a patient's vasculature, you give them more water basically into their blood vessels, blood volume goes up, therefore blood pressure goes up. Does that make sense? When you introduce more air into a closed volume, you have increased, I guess, air volume, you have more atoms coming in, therefore you have more pressure going up. Does that make sense? More atoms means more pressure in both cases. Cool. More atoms means more pressure. So this is going to be kind of the basic concept for this right here, right? So whenever you have excess air or a whole lot of atoms entering the pleural cavity, we increase the pressure there. When you increase the pressure, you cause a lung collapse. That is called a pneumothorax. This is what you heard him referring to, a pneumothorax. Okay, remember, somebody got stabbed, whatever. You introduce air into the pleural cavity, collapses the lungs. It's called a pneumothorax. The other thing that could happen is that this person gets stabbed, or maybe there's some kind of aneurysm, whatever happens, they could have blood enter into their pleural cavity. Well, guess what? Just like air, blood is made up of atoms. You introduce more atoms into this closed environment, more atoms means more pressure leads to a collapsed lung. Okay, so in any event, well, let me go and introduce the next one as well. So that's hemothorax and pneumothorax. More atoms, more pressure, collapsed lung. As soon as they start lecturing, they start doing all that stuff outside. It's kind of like when you're in a hurry in traffic, right? You're trying to hurry to your appointment, and then the slowest drivers in San Antonio just show up out of nowhere. It's the same thing. They all just start making noise outside, right? In pleural effusion, this one requires just a little bit of explanation. So we talked about serous membranes, right? Serous membranes, we talked about that already, okay? Serous membranes are going to secrete serous fluid. Okay. So this serous fluid is analogous to oil in your car. All right. So who knows why you put oil in your car?
Lubricate, like the, I don't know, like it acts as something for the like engine and all that.
It does, but what role does it play? I'm looking for one word.
Lubrication.
Very good, very good. Excellent. It's lubrication. Okay. What happens is you have these metal components always bumping up against each other. Like, for example, like the pistons in the engine, these are metal moving parts. They're metal moving parts. And so what you don't want is you don't want metal rubbing up against metal, right? That's going to cause everything to kind of deteriorate. Okay. So that oil in your engine, the reason why you get your oil changed, what, every 3-4-ish months, right? We're all doing that. Okay, is because we want to lubricate the engine's parts. Does that make sense? Okay, it's a lubrication. So same thing happens here with serous fluid as well. It acts as a lubricant. If you think about your lungs and your heart and your stomach and liver, everything is squished up together. Everything's squished up. And so they rub up against each other, much like the metal parts in an engine rub up against each other. So to prevent them from kind of chafing against each other and causing ulcers and other things, what happens is there's a fluid called serous fluid that is going to lubricate these organs, right? In this case here, the serous membranes of your lungs are also going to be producing serous fluid. And we call that, and if there's an excess buildup of that serous fluid, in this case called pleural fluid, If there's an excess of serous fluid, we call that pleural effusion. So if you have too much of a fluid entering into your pleural cavity, that means there's more atoms there. That means there's more pressure there. That means that the lungs collapse, right? All right, does that make sense, y'all? This kind of sum up right here. Okay, all three scenarios lead to a collapsed lung just because you're throwing off the pressure there in the pleural cavity. Okay, that's all three of them. Now, when you have a collapsed lung, okay, the clinical term for that is called atelectasis. Right, atelectasis. The stress is on the third syllable. Atelectasis. Okay, so while most of y'all are writing that stuff down, if you look at this X-ray right over here, again, my radiology is like garbage. I know pretty much nothing. I'll be honest with you, right? But one thing that many of you have seen is you've seen chest X-rays before, right? And usually there are these big dark spaces here. Okay, now these actually aren't spaces. This is actual lung tissue. So when you see these dark spaces here, it's the lungs, right? So here's the lung right over here. Here's the lung right over here. But look at this. Do y'all see that? That is a collapsed lung. That is atelectasis right there. All right, for whatever reason, this person's lung is collapsed.
This may sound dumb, but is there a way for the opposite to happen, for like your lungs to like explode?
The lungs to explode. God damn. I mean, you'd have to have some kind of final destination scenarios. I can't think of anything. Because in order for the lungs to explode, you would need to totally close off all kind of orifices, like anything like that. So you would need a closed environment. And at that point, you'd probably also need bacteria to produce gases. So this person's probably already dead. I mean, that's the only way I can think of it. Have you ever heard of the exploding whales on the beaches? Y'all ever heard of that before? Yeah. A couple of y'all, Will, you've seen it. Jessica and Yesenia, have you all seen that as well? Yeah, what happens is that you have these whales that have become beached, right? They're stuck on the beach for whatever reason. And they die, obviously. And what happens is the bacteria that's within them, or the bacteria that get inside of them, start to eat away. Num, 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 num. As they eat away, they produce gases, and they're often in a closed environment. And so what happens is these gases build up over days or weeks. And at some point, the damn whale just explodes. So that's the only scenario. Was that Freddie asking? that you? That's the only scenario that I see that somebody's lungs would like actually explode. Because what happens is your ribs as well as your muscles are helping to contain your lungs, so they would usually prevent them from exploding. The
Maybe
only what's that?
possibly, I don't know. Just thinking about like scuba diving and diving injuries, maybe.
Oh yeah, that'd be another one. Yeah, correct. Ah, damn, you got a good one. Yeah, one thing that I was going to teach, but we just don't have enough time, is going to be the bends. And what Chris is talking about there is that usually you have nitrogen dissolved in your tissues and blood. But what happens is if a scuba diver who's been deep in the ocean surfaces too quickly, that nitrogen bubbles out of solution, right? It comes out of solution, kind of like, how you would like shake up a soda like that. You shake up a soda and then all that CO2 gets liberated. It kind of comes out. Y'all know what I'm saying there? Same thing happens when a scuba diver surfaces. If they go up too fast, all that nitrogen bubbles out into their tissues and into their blood, and that would certainly expand out tissues. Yeah, so Chris is right. So Freddie, it's plausible.
I was just curious because like if a lung can collapse, can it burst from the inside?
Yeah, I mean, in the video that we just showed, there was a bleb that they were talking about here. These little blebs, and if they rupture, then I guess it wouldn't be a violent explosion, but they would kind of pop, I guess. But when you asked me the question, I was thinking like explosion for whatever reason. I just went to the extreme. I don't know why my brain went there. All right. So I made some adjustments to y'all's study guides, and I'll go over that a little later on. We're really good on time right now. Don't beep at me. All right. All right, let me explain one more thing. I'll play y'all 1 or 2 videos, and then we'll take 1 more 5-minute break. Sound good? Okay. So one thing we talked about earlier was that the lungs went to naturally collapse. 1, due to natural elasticity, and number 2, due to surface tension. Okay, so what the hell is surface tension? Okay, so here's my stupid example. Hopefully it's not too long-winded. And I have to be careful with my words because today's environment, a lot of people are a lot more sensitive, but I'm not getting that feeling from y'all. I don't think y'all are that sensitive, right? So I have cousins over in California, and they're a little bit younger than I am. So they're still in their 20s, I think. And their whole lives, again, just go with it. I'm not trying to say anything, right? For some reason, all their whole lives, they've only dated Asians, right? For example, I'm Filipino and they're Filipino as well, but they've only dated other Asians. So like Filipino, Korean, whatever. Does that make sense? They only seem to hang out with other Asians, right? And so in my head, just kind of passing thoughts, I'm kind of thinking, and I'm stealing this from a comedian, Baskin Robbins has 31 flavors, all right? Vanilla is great, but they have 30 other flavors there that you could try. And so all they've done their whole lives is just date other Asians. I'm like, you don't want to try that? You don't want to try that? It's up to you, right? So here's what happens is basically what I'm trying to get at, my stupid story, is that they only want to hang out, they only want to date other Asians. Does that make sense? They only want to hang out with people that kind of look like them. Everybody cool with that? Yeah? Okay. Now, why the hell am I telling you this? I'm telling you this because it actually relates to the lesson. What we're going to find out is that water, much like my cousins, only wants to hang out with other water, and that's it. Okay, water only wants to hang out with water, all right? So let me show you this quick video on this kind of this penny experiment. Okay, I feel like you all could do this at home, and I have a feeling some of you might, but this is kind of neat. Again, water only wants to hang out with water. It's like, no, I'm not letting go. I'm not letting go. This is going to be the most exciting 2 minutes of this class. Oh. Compare that to ethanol. It collapses pretty fast. Okay. But you all see what I'm saying here? Water only wants to hang out with water. Does that make sense? It's like, no, I'm holding on to you. I don't care if the air is on the outside. I'm going to hang on, right? That's called surface tension. Everybody cool with that? Surface tension. Okay. Now here's the problem. If you do one of these things, like that, okay, what happens to glasses? They get kind of foggy, right? Okay, this is water vapor. Okay, so where the hell is that water vapor coming from? From the ether, from somewhere? No, it's coming from the respiratory system. Okay, so what happens is there is water located in your lungs, right? There's water vapor in your lungs. Well, guess what? That water, guess what it's touching? Your water is touching your alveoli. Does that make sense? There's water on your alveoli. So guess what? If, what was the analogy I used yesterday? If my hand represents water, my other hand represents water, my forearm represents an alveolus, my forearm represents an alveolus, right? So what's going to happen is water wants to hang out with the water, right? So if they want to hang out, guess who else is to hang out with each other? The alveoli. Does that make sense? Water is going to pull alveoli along with it. So as long as that's going to happen, guess what? The alveoli want to naturally collapse on themselves due to surface tension. Does that make sense? Okay. Was that kind of a long-winded analogy, or did it work? Okay. Water only wants to hang out with water, and that's why the alveoli want to collapse, right? So again, go back here. Why do the lungs want to collapse? Natural elasticity and the surface tension created by water. Okay. So there is something that is preventing our lungs from collapsing due to surface tension. We call that surfactant. If you recall, little throwback over here, surfactant was produced by those type 2 alveolar cells that we were talking about earlier. Right here. Surfactant is secreted by these guys, type 2 alveolar cells. What surfactant does is it decreases the surface tension created by water. Okay, so surfactant decreases the surface tension created by water. So long story short, they're preventing your lungs from collapsing. Y'all ready for WandaVision tomorrow? Yeah. Extra credit for you. All right. Okay. Oops, wrong one. Oh, I'm on the wrong PowerPoint. All right, that is surfactant. Okay, let me explain this and then we'll take a break. Okay, we'll take another 5-minute break and then we'll kind of end class shortly thereafter. Okay, so that is surfactant. Now, here's the issue here. When it comes to infants, for example, infants, premature infants specifically, right? Usually when you talk about infants, they're born between week 38 and week 40 of gestation, basically week 38, week 40 of pregnancy. Does that make sense? Which is about 9 months, okay? If an infant is born before the 37th week, before week 37, that infant is considered a premature infant, right? They're considered a preemie. Everybody cool with that? Okay, preemies. So oftentimes, don't y'all see preemies on like ventilators? Don't y'all see them on ventilators usually? They need help with breathing, okay? What happens is that with infants, one of the last structures to develop is actually the respiratory system. Y'all see where I'm going with this? Is the respiratory system. Specifically, these infants are not creating enough surfactant. Okay, I'll say that one more time. One of the last structures to fully mature in an infant is going to be the respiratory system. Specifically, they are not creating enough surfactant. Okay, so preemies don't have enough surfactant. Oftentimes, not all the time, oftentimes. So if you don't have enough surfactant, what do you think happens to your lungs? What happens to their lungs?
Collapse.
They collapse. Very good. Good. Excellent. I saw y'all. Very good. They collapse. Okay. So oftentimes what happens is that these infants, okay, will need these ventilators. And these ventilators, many of you have heard of before, are called CPAPs. Okay, let me kind of get rid of this. Here we go. CPAPs. I would definitely write this part down. Okay. A CPAP stands for, as a lot of you know, continuous positive airway pressure. That is a specific type of ventilator, continuous positive airway pressure, CPAP. While you're writing this stuff down, over at UT Health Professions, sorry, at UT Health Science Center, most students go for either medicine or they go for dental or they go for nursing. That's what they usually go to school there for. But they have another program there called the Health Professions Program. And what happens there is that you have other professions that you're still working in medicine, but in a different capacity. And one of the programs that's there is respiratory therapy. Okay. So if you're not feeling being a nurse, if you're not feeling being a doctor for whatever reason, there's other professions out there that pay well and they're in high demand all the time. And the funny thing is, because we visited UT Health a couple times, our school before COVID, and we've had them come and speak to us as well. And they almost have to like beg students to enter their programs. One of my students, I think he graduated already at this point. He when he was in my class, he applied for the respiratory therapy program, and they admitted him before he was even done at SAC, before his grades even came in. So he said, as long as you pass ANP2 and micro and all that other stuff, you're in the program. So if you're curious about other professions, right, other fields, you might want to consider UT Health Professions. Right? They have other things there, emergency medical services, respiratory therapy, things of that nature that nobody ever talks about, but they're always in high demand. Okay. So a little tip from me to you, check out respiratory therapy. There's usually plenty of spots open. Also, go ahead, I'm sorry.
I was just saying there's a lot of mucus in that profession. A lot of mucus.
A lot of mucus where? In that profession? Yeah, nobody ever talks about that. I mean, until COVID came around, I mean, not many people talk about respiratory therapy all that much, but now it's in pretty high demand. So, oh, here she is again. Yeah, so check it out. Just there's other professions out there than just being a nurse or a doctor. Okay. Oh yeah, you're right. A lot of mucus. All right, that is a CPAP. Now, think about CPAPs, continuous positive airway pressure. What does positive pressure do again? Hadouken, right? Good. It pushes. Okay. Positive pressure pushes, right? So what's happening is this poor infant's lungs and their alveoli are collapsed. So we're literally pushing air to reinflate them. Does that make sense? We're pushing air in to reinflate them. That's positive pressure. Positive pressure pushes. Okay. Now, unfortunately, because this infant structures are so thin, oftentimes there's going to be long-term damage to the respiratory system. Okay, but at least this infant's living. Everybody cool with that? Those are CPAPs. Okay. The other population that needs CPAPs, some of you are familiar with this, either personally or you know somebody that has it, are people that have usually something called obstructive sleep apnea. Have you ever heard of that before? Any of you have it? Any of your partners have it? Okay. This is what it's, go ahead.
My father.
Your father has it? Yeah. My dad has it as well. So here's what happens. Oh, Jessica, yeah. Here you go. So this is what it sounds like. Ready? Have y'all heard that before? Jessica, you've heard that before, right? Yeah. So just like what Jessica's saying, I mean, that stuff is scary because this person stops breathing for like 30 seconds, like a minute or even longer. They're not breathing. So they're building up CO2. They're not getting enough O2. And by the time they start breathing again, what do? They start gasping because they're at an oxygen deficit, right? They've lost out on oxygen. And so the reason why at least obstructive sleep apnea occurs usually is for this reason, right? You kind of watch me over here. Usually it occurs when they're laying down like this, okay? And if you think about the anatomy, the muscles of their throat, or maybe even their tonsils are enlarged, what they're doing is that the muscles relax a little bit too much. And when the muscles relax a little bit too much, the airways close a little bit like this. Does that make sense? Muscles of the tongue, muscles of the throat, they close a little bit like this, sometimes to the point where they completely close. Does that make sense? And that's what causes that kind of obstructive sleep apnea. It's either because of enlarged tonsils, it could be because the muscles are relaxing a little bit too much, it could be caused by obesity, okay? But something is causing the airways to kind of shut when they shouldn't be shut, okay? I had a student, again, sorry for another story time, a couple of years ago. Any of you know CJ? Any of you know CJ? Were y'all there? Oh, no, it's been a couple. Man, I feel old now. He was there just, I think, 2 years ago. Now I was at TLU. Oh, by the way, another tip for y'all. Here we go. Write this part down. TLU has to practically beg students to enter their nursing program. Okay, everybody wants Baptist, UIW, and UT Health. Nobody knows about the TLU nursing program. They actually, I don't think they ever fill up. Well, in recent memory, they don't fill up their classes. And so they have to beg students there. So Texas Lutheran University over in Seguin, right? The problem with TLU though, heads up, it's a private school, a little bit more money. Okay, but so is UIW. Okay, so there's some tips for you. Respiratory therapy at UT Health and TLU nursing program. Okay, usually you can get in, right? Anyway, so my student CJ, he was I think he was in the Army before, and he went to the VA. And what happens is he entered a sleep study. He's like, why the hell do I feel so tired all the time? He was always like knocking back some caffeinated drinks. So they did like a 3-4 hour sleep study on him. And what happened was he had obstructive sleep apnea. And the thing is, when you have sleep apnea, when you stop breathing, technically you wake up. Does that make sense? So watch this. In a 3 to 4 hour span of him sleeping, he woke up, I think he told me 60 to 70 times. If you can believe that. He woke up that many times. Now, the thing is, you don't realize you're waking up, but you do, right? So y'all remember REM and non-REM from AMP1? Remember REM, non-REM, rapid eye movement, non-rapid eye movement, and sleep? So again, you go through these cycles of sleep like this. But the problem is if you keep waking up, all right, non-REM, oops, I woke up. All right, non-REM, oops, I woke up. All right, REM, oops, I woke up. So even though he would get like 8 to 10 hours of sleep, how much quality sleep did he get? Not much, all right? So what they gave him was so basically it was ruining his day. He wasn't getting enough sleep. So they gave him a CPAP, and the very first day that he used it, he said that's the best sleep he's ever gotten. He said he didn't need caffeine in the morning. He didn't drink any coffee. He felt great. He had the most energy there. Does that make sense, y'all? how much that sleep apnea can really affect a person's quality of life. Okay, I know that was a bit of a rant, but hopefully that kind of pushed our point a little bit. Okay, let me play a quick video for you. There's always gonna be time for Batman. I don't care how behind we are. Have you all seen The Dark Knight Rises? Have you all seen that movie? Yeah. Okay, good. Extra credit for y'all too. Very good. So here's what happens. I watched the movie and I was like, no way. So I'm thinking Bane's mask is actually a scary looking CPAP. Right? Here's what happens is that earlier in the movie, and I hate to spoil it for y'all, earlier in the movie, Bane essentially, he gets his ass whooped, right? In prison, they beat him up like really, really bad to the point where he needs medical attention, right? And so he has his mask on, and what you notice is that as soon as Batman kind of messes with a mask, he has trouble breathing. Okay, so kind of watch this this video here, and let me know what you think. See if you agree with me or not. Where is it at? Here it is. All right, here we go. So it's fine, it's fine. All right, y'all get the idea. I'm gonna keep watching that movie now, right? I was getting really pulled into it. I forgot I was teaching, right? So whenever Batman punched his CPAP, right? Didn't you hear a hissing? Did y'all hear that? If you hear a hissing, that means that air is being pushed out. It's under positive pressure. So if that's under positive pressure, guess what? That's probably a CPAP. I was like, poor Bane has a CPAP. He snores at night. Oh my gosh. All right. Did I kind of get that point across with the whole CPAP thing and all that stuff? Positive pressures. Okay. Let's take one quick 5-minute break and I'll wrap up class. Okay. One more 5-minute break. Okay. So when it comes to the rest of this, there's still a lot of presentation left. Still quite a bit left. And the reason why there's so much left is because, remember, we dedicated so much time to the immune system. Y'all remember that? An immune system review on Tuesday. So if we had that time, we could go over all this stuff. So here's what I'm going to do is we're going to cover up to spirometry just really briefly over the next like 5 minutes. And the rest of this, I know how much y'all love my videos, okay? The rest of this, I already pre-recorded video. It lasts like 16 minutes. It's not that long. Okay, 16, 1-6. Okay, so there's not much left there. Okay. All right, really quickly, spirometry. Okay, now the reason why this part makes me sad is because this was the last chapter I think we did right before COVID hit, and I never saw my students again in person. Okay, and the lab for this one was, we were gonna do a lab that involved sharing a device that involved breathing into it. And it was called these spirometers, these handheld spirometers, which were like decades old. And because we heard at the time that COVID was respiratory related and it could be transmitted through all these different things, I was like, you know what? Let me go ahead and hold off on the breathing thing if there's a breathing disease going around. So what this is called a spirometer, right? This is called a spirometer. And what spirometers do is that they assess respiratory volumes and capacities. They assess how much you can breathe in, how much you can breathe out, right? It's called tidal volume. They measure how much extra air you can breathe in, how much extra air you can breathe out. That's called reserve volumes. And they measure other things like vital capacity and all that other stuff. Okay. So basically, long story short, they are going to measure respiratory volumes and capacities. Okay, they measure respiratory volumes and capacities, spirometers. Okay, they come in different forms. The kind of cheap one that we had at school was on the right-hand side. This is another kind of not very expensive one either. There's more sophisticated spirometers out there, but this is what we were working with.
I actually used to have one of those.
You had one of these?
Yeah,
Oh, wow.
the one that left.
Oh, this
So,
one here?
yeah.
Oh, wow. Did you have
Yeah.
like really bad asthma or what
Yeah,
happened?
I had really bad asthma growing up, and like it was like the way I had to like practice at home.
I
And
see. To make
it was
sure.
like I remember like how out of breath I would have to be because like you had to like you can't breathe too hard or too low. You have to keep it like right in the middle for
Is that little ball kind of floating?
yeah.
Yeah. Yep. That is definitely a spirometer right there. But you seem to be doing just fine now, so it seems like it improved over time. Very good. All right. Now, here's the thing with a spirometer, y'all. You want to be very careful with this. Spirometers are not used to diagnose specific diseases. Okay? They're not used to diagnose specific diseases. You can't say, oh my gosh, this person is short of breath. Looks like lung cancer to me. All right? It doesn't work that way. Okay? They cannot diagnose specific conditions. All they can do is tell you that something is wrong. Okay? So they can't diagnose things specifically, but they can tell you something is wrong. So they have a disease, but we don't know what this disease can potentially be, right? But it does narrow things down, right? More specifically, it can narrow down between obstructive pulmonary diseases and restrictive pulmonary diseases. Okay. An obstructive pulmonary disease is one in which patients cannot fully expire or exhale. Okay, they have trouble getting rid of CO2. Asthma would be one of them, for example. Bronchitis. Okay, they cannot fully get rid of all the air. They can't exhale properly. Something is preventing them from blowing out all that air. It could be mucus. It could be muscle spasms. It could be swelling. Okay, that's an obstructive pulmonary disease. And you can kind of tell this if you look at some of these spirometry kind of readings here. Okay, which we're not going to go over. I'm not going to hold you all responsible for this. Don't worry about this. I actually eliminated it from your practical study guide. Okay. The other thing that it can help to kind of narrow down is if it's a restrictive pulmonary disease. In this case, this person cannot fully expand their lungs / pleural cavities. Okay, so when you get to nursing school, medical school, respiratory therapy school, wherever you go to school at, you'll learn a little bit more about obstructive and restrictive pulmonary diseases. Okay, but at least you know about them. Okay, so one type of condition that is a restrictive condition would be something like obesity, right? For some patients that are morbidly obese, for example, they're like 500 pounds, 600 pounds, or whatever, they're going to have trouble breathing because all that weight is preventing their lungs from fully expanding out. Does that make sense? Okay, so obesity would be an example of a restrictive pulmonary disease. They just have trouble expanding out their lungs. All right, questions? Oof. Questions, comments, concerns on spirometry? Everybody cool with that? Okay.